Now, doctors in Singapore say the latest COVID-19 wave has peaked, even as clinics still face higher than usual patient loads, while they're seeing cases stabilise, down by some 20% from a high in December. But they are already planning for more manpower and medication in anticipation of another surge in the months ahead. Sherlyn Seah has the story.
Healthway Medical now sees an average of 50 to 60 patients come in daily with respiratory infections across its 57 clinics. COVID-19 and influenza cases make up the bulk of them. This is some 10% higher than normal patient loads, but a slight drop from the peak around Christmas.
The peak of all the upper respiratory tract infection cases has plateaued. Majority of people has already returned from traveling in the past 7 days. We are actually seeing a slight reduction compared to the weekends from the 19th of December cross to the 26th of December.
One Care Medical is also seeing cases stabilise across its 38 clinics and says cases are less likely to go up significantly again in the near term. But doctors are watching out for possible surges in the coming months.
The Chinese New Year coming up, there will still be ongoing gatherings. And of course, there are still some travelers traveling, especially those who want to take advantage of the peak season. If the weather continues to be quite cold and there continues to be a lot of circulating strain of ARI pathogens, then perhaps you might still see the numbers being sustained.
With that in mind, clinic chain UniHealth is preparing its resources in advance. COVID-19 cases are down by some 20% this week across its 3 clinics, but the group's still keeping its guard up.
We need to keep close surveillance of the situation. So, for the medication-wise, we tend to be a bit more over-prepared. So, we tend to stock in more prior the expectation of this peak. Same as the manpower. The thing is, if we notice that there's increased cases and caseload, we might deploy more manpower in our clinic itself to basically ease off the waiting time for the patients.
UniHealth orders about 30% more medication than usual when they anticipate a surge.